Fitzgerald on the Interactive Lunch.
0845 301 1034.
BBC Radio Devon.
12:33. Now, earlier you were giving me your reaction to the news that some dentists are misleading their patients about the right to NHS dental treatment, so they pay for private treatment instead. Well, in some parts of the world, many people have no access to dental care whatsoever. And in fact, we were talking to other people who'd experienced the situation in America where basically you pay through the nose. Well, as a group of Devon students are off to India this summer to spend their summer helping them, Miles Hindes is one of them and joins me in the studio. Miles, good afternoon.
Hi, good afternoon.
Have you been to India before?
No, I have not. It's going to be my first time going, so it's going to be a whole host of new experiences, I hope.
What are you going to be there doing, and have you been briefed at all on what's waiting you?
To some extent, there's a group of 6 of us in total going out to North India. Going to be going to a place called Palampur, where we'll be spending 2 weeks in clinic settings, hospital settings, and also in sort of dental camps that they're going to be running throughout schools. We're currently 3rd year at the Peninsula Dental School, and that means that while we're over there, we'll be able to do anything from scaling, fillings, to extractions.
Taking the equipment with you, I'm guessing?
We're sort of in contact with them at the moment. There's certain equipment we have to take with us with regards to what we call PPE, which is personal protective equipment. Sure. So taking our own masks, gloves, aprons. But from the sounds of it, they're relatively well equipped to deal with restoration, so fillings and extractions.
So you will be working within a dental school or at least a dental laboratory over there?
From the looks and from speaking to them over there, they have one sort of dental clinic where they have 1, maybe 2 chairs where we'd be working in under the supervision of a qualified dentist over there.
Oh, right, OK. It's going to be a trip into the unknown, yes?
Yes, it certainly will be. Just dealing with the different culture, the language barrier, obviously. Because I was saying to one of my friends, communication is a often overlooked aspect of dentistry, but is a very crucial one. And over there, it's going to be more important than ever, trying to understand their dental problems, then that going through a middleman to then interpret that to us. It's certainly going to be exciting and a little bit nerve-wracking.
Indeed. What got you into the world of dentistry?
To be honest, initially at sort of 11, 12 years old, you look at those jobs that are going to get you the most money. And that's me being brutally honest. But then as I matured and grew up, more and more of it just looked like positive aspects I wanted from a career. So hands-on, no 2 days really being the same, interacting with different people and just doing something that I enjoyed.
They always said it was one of the most depressing things to do, to be a dentist staring into people's mouths day after day after day. It hasn't gone through your mind?
No, I love it. Every second of it.
I salute you for it. It's taken you how long?
Well, till we got to Peninsula Dental School, because it's graduate entry. So all of the students there, including myself, we've done a degree beforehand. So I spent 4 years doing that. And then now we're in our 3rd year of a 4-year course. And then we graduate this time next year. And then we have to do a vocational training year, which is sort of working under the wing of a dentist for a year. And then after that, we're free into the big wide world.
Rather like, and I'll be dining with some catering students in a couple of weeks' time. They practice on people like me, which is very kind of them. Yeah. Do you actually have volunteers to say, all right, at some point in your training, fill this?
Pretty much. The one good thing about Peninsula is they'll get us into clinics early. So in the first year, about 6 months in, we started up at clinics in Exeter, 1 day a week, just doing what we'd been taught up until that stage. So it's simple sort of procedures, so scales and polishes and things like that. And then as the years progress, we spend more and more days in clinic. So being a 3rd year student, we're currently in clinic 3 days a week. And that's up at Devonport, where we have patients and see patients as normal doing all of the various dental procedures.
How old are you now?
I am 25.
25?
Yeah.
Ladies and gentlemen, dentists are looking younger these days. Are you happy to stay and talk a little more about what you're doing? Yeah. 25. Would you trust this man? Look at him. in the final hour, Miles Hindes, who is off to India to... is it Palampur, did you say?
Palampur, yeah,
Palampur,
North India.
Which is in North India. I was going to mention, I just noticed, flicked over the notes here, and actually it does actually pop up. Is it the betel nut that they chew on a regular basis?
Yeah, betel quid. I think it's also known as pan. Is quite a big problem over there.
Yeah, because that does cause mouth problems, ulcers and cancers.
Yeah, oral cancer's the main one. It's not something that we see too much of over here, but over there I imagine we may see a great deal more of it.
But every dentist is trained in this country, and I'm guessing you have as well, to take a look at gum disease and also oral cancers.
Yes, it's not just... A lot of people just associate dentists with teeth, but we have to look out for a whole manner of oral problems and symptoms and things, as you say. So that could be gums, tongue, cheek, palate, and then we also have to look at extraorally as well. So when we first see a brand new patient, you do an extraoral exam, just looking for any signs and things that people might not notice, and then questioning them a bit more about it, you start to build up a bit of a picture and you start to think, oh, actually something might be going on. So not just teeth.
80% of the Indian population probably have no dental care whatsoever.
Yeah, I think 80% of the Indian population live in rural areas, and it's in those rural areas where there is very limited access to dentists, and they're often the areas that need the access the most. So that's one reason we're doing it, is to try and get out into those areas and, at least for the time we're there, offer our aid and help.
But to get out there, you're going to have to raise the money as well for the flights. It's not a paid for...
No, there is some dental electives or electives in general are run in conjunction with the schools as part of the curriculum. Ours is totally through choice, so organised by us. And yeah, there are cost implications that at the end of the day, if sort of sponsorship and that sort of thing aren't raised, we'll come out of our own pockets.
How long will you be there?
We're going to be in India for about 6 weeks in total, but doing the dental elective just for 2 weeks of that.
But is there going to be a flow of people after you as well? And obviously I'm guessing there's people before.
Yes, it's something we're doing it through a company which we found online, and they're continually sending dental and medical students out there. They offered a range of electives for sort of medical, dental professions, and even just normal anyone else who wanted to go out and volunteer and help.
Well, let's get into the political side of things, and you will have to, as your career does branch out. It was the OFT says 500,000 people a year are paying for private dental treatment, wrongly being told. What have you been taught so far about the structure of dentistry, not dentistry itself, but the legal side of things and the patient's rights?
Well, all through our degree, there's a heavy focus on ethics and looking at the patient as a whole and building a treatment plan that is agreed by not only yourself but the patient themselves. So you run in through all the different procedures, treatments, any potential treatments that may happen with the patient, and agreeing to a solution to their problems together. And that is very heavily focused on from the start here. More of the, I would say, the business side of dentistry and that sort of thing, I believe, comes more into the fourth year. So we'll start to learn a bit more about that next year.
It's actually, I'm just watching the reports coming in. There's, I don't think the press are going to let this one go. There has been some sort of mis-selling or at least misinformation on all of this. But that is all part of your course. In the long run, you will be taught basically what the patient must be told and how they are set out. I mean, I take it you will leave your tutoring and go into private practice, or would you like to offer an NHS-style treatment?
I personally would like to at least do some work NHS, just because being postgraduates, our course, the final 3 years, so everything apart from the first year, is funded by the NHS. And I'm of the thinking that for them to do that, it would be unfair for me then to go straight into private practice without at least giving something back. So I'll obviously graduate from here, do the VT year, and then work NHS, just because that's what I think that seems fair.
Well, I wish you every luck for the future. You graduate when?
This time next year.
This time next year.
Hopefully.
Oh, will you pop back in this time next year and let me know how it's going?
Yeah, certainly.
And
We'll
update
be
your
more than
career.
happy to.
And you're away to India when?
We leave on July the 11th, I believe, and we start the elective on July the 16th.
Fantastic. And you've got all the money in place for this trip?
Well, there's money there. Obviously our own money and that sort of thing, but I mean, if anyone does want to get in contact and find out a bit more about it, then just get in contact with the dental school.
Okay. And who are you going with? You're not going alone?
No, we're going, there's 6 of us students, all in the 3rd year, all going.
Jonathan Hope?
Yeah.
Charlotte?
Yeah, Charlotte Nestoruk.
Lovely. Tanya Tucker, Katie Ann Rao, and somebody very Welsh.
Yeah, Lowry Davies.
Lowry. I know a Lowry. Did she tell you off immediately? You say Lowry, and it's Lowry.
Yeah.
Yeah, I know I got a Lowry that I deal with on a regular basis. It is pronounced Lowry.
We just call her Low.
Low.
It's easier.
Oh, charming. Listen, it's been an absolute pleasure to talk to you. Good luck in India and good luck with the rest of your career.
Thank you very much.
Miles, you're a star.